Good morning, afternoon, evening, warriors, healers. Hello, friends. It has been a while since I did an update video. So this is an update video, and I want to keep it brief and I want to keep it short. The first thing I want to say is that there's a virus out there. We have been seeing many patients calling us, coming to our doors with a virus, whether it's respiratory or GI. So please, please, please take care of yourself. This is the perfect time to boost your immune system. Whatever that you're doing for your immune system, double that, okay? Because we are entering into winter. This is fall. It's allergy season. It is flu season. It's viral season. And many people are getting sick right now. And if you are sick, I can guarantee you are passing on whatever you have to your family members, to your loved ones. Okay. And COVID is still here. COVID didn't go anywhere. So we are seeing quite a few COVID cases. So to help you, if you don't know what to do to boost your immune system, like with Dr. J, I don't know what to do, reach out to us. What we have been doing to help those that have been coming in, contacting us, letting us know that they need help, they are struggling with a virus, right? Or fever, chills, or body aches, or nasal congestion, post-nasal drip, or anything that is not out of the norm. We have been helping them with IV vitamin therapy. This is the most effective way, safe way, like really quick way of you bouncing back. IV vitamin therapy. So if you live in New Jersey, please reach out to us. If you don't live in New Jersey, you're watching this, find you an IV vitamin therapy clinic that uses IV vitamin components for healing purposes. I'm not talking about a spa or a lounge, like literally high dose vitamin C, right? To boost your immune system. Zinc, NAC, L-arginine, the B vitamins to literally help you recover quicker and faster because it is going to get worse. And I'm not here to create fear, to tell you something that is not true, because that's exactly what I've been saying in my practice. And many of you watching this video can attest to that. Right? Like, well, you're right, Dr. Genty. I had a virus, right? I had body aches and I have chills and I have all kind of, things that keeping me from performing at my best. Yeah, it is a virus. And the bacteria infection is not that popular. We all get viruses. So therefore, if you go to your doctor, you go to an urgent care or emergency room, they give you a Z-Pack, it is for bacteria. You're not really addressing viruses. So here in our clinic, what we've been doing, we've been boosting people's immune system. We have different drips, different, formulations for different purposes, different disease. So if you're looking to boost your immune system, either you have a virus or you want to prevent getting a virus, then the high dose vitamin C is for you. Okay. If you do have a virus, it's like, okay, I am literally symptomatic right now, then the antiviral is for you because the antiviral drip has the component for energy, also has a few things for viruses, and then ozone therapy. My friend, do not sleep on ozone. Please do not sleep on ozone. We've been seeing great results with ozone therapy. I'm literally infusing oxygen into your cells, into your body. There's no way after doing a few sessions, you will not, you're going to feel sick. There's no way you're not going to feel the benefits of it. So ozone therapy, please. Antiviral, and then high dose vitamin C are the three drips, infusions I would highly recommend to prevent you from getting sick, or if you are under the weather, to bounce back. Viruses do not go away. Even if you don't feel well, even if you feel like, okay, my symptoms are gone, trust me, they're still in your body. So when you go under stress again, or if you are to be in an environment where somebody else is sick, you will feel the symptoms. And if you have hormonal imbalance and your cortisol are out of whack, so the cortisol will decrease your immune system. So that will put you at risk for more sickness. Okay? So as you are boosting your immune system, tackling the viruses or preventing from getting viruses, also think about managing your stress. So high dose vitamin C for those that are coming to me with viruses right now. If I know they have viruses, we've been adding extra stuff for them, like zinc and NAC and the high dose vitamin C, just lower dosage. But if I know you are severely symptomatic and you need energy and you are dehydrated, then the antiviral will be the best bet for you because it has the electrolyte in it, plus the B vitamins for energy, and then the component for viruses. And ozone is good for all of the things. Ozone is good for autoimmune conditions, Lyme's disease, Epstein-Barr virus. Ozone is really good for just like its overall health. When you think about ozone, think about addressing many of these ailments, with one thing, because it's just your blood, oxygen, we filter in the blood, we put in oxygen and we put it back into your body. It's a beautiful, 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 simple, yet effective treatment. Okay. Hydration, you should be drinking plenty of water. Make sure you put some electrolyte in your water. If you need electrolyte recommendations, reach out to us. We can add something on full scope for you. There's one that I use for many of my patients. Allergy seasons, I'm literally, as I'm talking to you right now, I have a patient that's in my signature program and we are giving her allergy. So you don't have to take the Zyrtec. You don't have to take Claritin. You don't have to take Allegra. You don't have to take Zyzol. You don't have to take any of these things if you have allergies. Change your diet because many of the food you're eating is literally producing histamine, right? Like histamine is what is giving you the reactions when you're exposed to the environment, histamine production. And then there are powerful herbs that we use right now because we know it's allergy season right now. So yes, allergy season, you can do something. IV vitamin will definitely help with that. Chelation therapy will help with allergy season. Why? Because chelation or chelation therapy is detoxification for your cells. It's removing the allergens out of your cells. And then you change in your diet, you stay hydrated. It's like a beautiful, 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 magical combination. Okay, so I wanted to do this video to tell you that please take care of yourself. We are moving into a season of allergies, viruses, stress. The holiday seasons is fast approaching, and then it's the end of the year, and you got to start preparing. Do not wait December and said to yourself, "Oh, I need to, be healthy." No, start now. Whatever you do 3 months prior, you're gonna reap the benefits 3 months later. So if you start now, you're gonna definitely feel better 3 months later. Another thing we've been doing for our patients as well, if you can find a practitioner that can help you, and I'm open to making this available, is ivermectin. I know ivermectin has tons of bad rep since COVID, right? Because the government kind of remove it out of the pharmacy. I make my own ivermectin. It is compounded. Compounding products is better. Okay, think about organic. If you were to buy blueberry, if you go to ShopRite, you buy blueberry that's not organic versus Whole Foods, blueberry that's organic. It's blueberry, right? But it's different process of blueberry. The process is different. It's a different, how would I say this? It's different. The blueberry that you're buying that's not organic has more toxins, herbicides, pesticides. This is the blueberry that you're buying that's organic, has less contaminants, right? It's a different quality. That's what I meant to say, different quality. So please, when it comes to ivermectin, can you buy from the pharmacy? I'm not sure, but work with a functional medicine doctor that has access to that, because this has been tremendously helping my patients with viruses. They will do IV vitamin therapy, and then they will purchase a few. You can purchase 3, you can purchase 5, you can purchase however. You don't have to be in a program with me. We just have to have you complete the intake form, because we do base ivermectin, the dosage, according to your weight, your body weight. So ivermectin can be very, very beneficial. Instead of you taking the Z-Pack or taking antibiotic or taking the amoxicillin or augmentin or whatever, azithromycin that the doctors are prescribing, why not try some ivermectin? It worked really well. It worked really well in the past. And then NAC, we put that in our IVs. okay, for our patients, because again, whatever you do intravenously, you get 100% versus the thing that you take by mouth. So this pill that I'm giving my patients right now, right? So when this patient takes this pill for allergy, which is a whole bunch of herbs, it's herbs. For allergy, that patient is only gonna get 15 to 20% of the herbs, right? So that's why when you take a supplement, it is recommended that you take it, like a few pills, like the dosage might call for 3, 4, 6, that's a lot of pills, or you take it frequently so that you can actually get something into your cells. But with IV vitamin therapy infusing the NAC, that helps a lot. NAC, it's beautiful. Glutathione, it's beautiful. Like I have powdered, I'm sorry. I have powdered that I give my patients that has L-glutamine, selenium. We put all that, glycine, L-cysteine, like glutathione. We put, like you can literally get glutathione for viruses. So NAC, glutathione, because glutathione has 3 amino acid in it. And then also for allergies, get you some herbs. Get you some herbs. It's gonna benefit you a long way. Okay? So please take care of yourself. Don't wait until you get sick to do something about it. No, like, preventative care is the best care in the world. Knowing that we're entering the season that many people will get sick, I'm telling you, many people is getting sick right now. Like, look around you. I'm sure you watching this video know someone that has a cold, someone that has a flu or COVID, someone that's like literally struggling, suffering with low energy, with brain fog, right? With stomach issues. Literally, I saw a patient a few weeks ago. Her whole family was sick. She's a teacher. And as a teacher, you expose, right? Like you gotta go to work. A kid was sick, but whatever bugs home, like the whole family is sick. So you can also do things for your kids as well too. So there are so many options for you, solutions, and I'm pleading with you to start going right now. Don't wait until you get sick, because when you wait until you get sick, you're spending more money. Those of you who wants to save money, more money, because the treatment and the program or the protocol is gonna have to be like intense and aggressive to to help you bounce back. And then you spending more energy, more time, and it's gonna be more stressful for you. So if you can get 1, 2, 3 drips right now, please do so. So that's what I wanted to bring to you, sorry. And then another thing I wanted to discuss with you, because I know last time when I did an update video, I told you all that I was gonna have an ozone promotion. I'm still planning on having an ozone promotion. And I want to do so before we raise our price, because every single vendors of mine send us letters, they're raising the prices. Like my prices went up. My price, the money, my expense, like I'm buying those supplies went up. So when I do the ozone, I'm gonna do some screenshots and show you guys the letters that I've been getting from the companies, because moving into 2020, the price of the ozone is gonna go up, and I have no option. I have no choice but to do that. My prices has been decreased. As a matter of fact, we decreased our prices for for the past year, because I was able to work with suppliers and begging them and buying more supplies, like bulk, to get the discounts. But that's something that they are not honoring right now, because with whatever's going on. So they are telling me, well, Dr. J, we can't afford to give you those huge discounts anymore, so we have to increase your prices. So therefore, I have to increase my prices so that we can keep our doors open, so that we can get compensated and take care of our families, just like you have to get compensated and take care of your family, and then so that we can continue serving the world. Before I do that, I'm going to do an ozone promotion. So for many of you who've been reaching out to me, I am so sorry it's taking me so long. It's taking me so long because I am in the process of hiring. And if you've been in my clinic, I am the one doing all of the things right now, which is fine. I'm learning more and more about things that I need to change for my business behind the scenes. If you're a business owner, there's always room for opportunities, improvement. We're always shifting and pivoting, and you own a business, you know exactly what I'm talking about. But I want to do so without changing the way I care for my patients, without changing the delivery. That will never change. I'd rather see less patients make less money like I am now, that's what's going on right now, because I don't have to help, I have to say no to people, than just, you know, increase my patients, not looking at my capacity and not being there for them. If you're a patient of mine, you know you have all of me. Even with everything that's going on behind the scenes in my business right now, you know you have all of me. I'm still, you wouldn't know if I don't tell you that we're going through a challenge right now. So with the ozone, I know when I open up the doors for the ozone, a lot of people will sign up, as they should, because again, prices will go up. And this will be my second promotion. We were certified. We had myself and my previous MA went to Dallas to get certified ozone. Because everything we do here, I learned from the gurus. I paid mucho money, a lot of money. I think the certification cost us close to $20,000. Yeah, to bring ozone into the into my clinic. And the supplies for ozone is special filter, the generator has to purchase, the oxygen thing I have to purchase, the UV LED light I have to purchase. And then it requires a lot of I use a lot of pieces, equipment for my ozone. I don't use the same needles. I use for one person, I'm using close to 4 needles. So that, increases as well. So it's, just to tell you there's a lot, although it's a simple yet effective procedure or infusion, but it's a lot involved. So I do things differently here. And I also, use syringes as well. I use 2 or 3 syringes for each person. So it's a lot. And for the price it is now, it's not even, we're like breaking even, if I'm being honest with you. And I'm being honest with you, because I always want to make sure that you know what I'm doing. I do everything with integrity and I'm being transparent with you. And I wish I can do this work for free, but unfortunately, it's not. I tried at the beginning of our practice and I almost closed my door because I was releasing and giving, my services for free. And if you're a patient of mine, you know that you get things for free. I'm always giving samples, right, for free. We always, once a month we do a free consultation. And a free follow-up visit. We did one yesterday for a patient, a couple, but a young patient that's struggling financially. So I did an office visit and it was complimentary. So I'm always giving. So please, if I increase my prices, because I literally have to. Okay. So the ozone is coming the minute I hire a person, which I've been interviewing plenty, but it has to be the right fit here. And many of you guys coming to my clinic, I've met some of them. Okay. And this is just not the right fit. So I'm willing to take a loss to make sure my reputation is still the same and we are still practicing the same and that people are still being evaluated, monitored, and serviced the way I want to. Okay. So that's what's been happening. I know a lot of you are asking, like, what's going on? What's going on? It's coming. I just need to get the help first because I don't want to jeopardize, the care that I have now. And I don't want to be burnt out and overwhelmed. And I don't want to, not have the capacity to support the people that I have now and then open the door for more people to come. So my capacity is increasing. And then the ozone is coming. I am pushing for October. I have a few people coming to shadow. So if they're a good fit, I'm gonna hire them. And all of them has experience. They at least have a phlebotomy experience, nursing experience. So they should be able to, just help me with ozone. So it's coming. It's coming. Save your money. It is gonna be less. The ozone is gonna be at least $10 less than it is now. It is a promotion so that I can encourage you and motivate you to purchase many, because one will never do it. As you know, it's one bag. People think one little IV is going to fix all the problem. No. Many of you guys have been struggling for years. So one IV once a week or once a month is never. It's like your tank is empty. You think 1 gallon or 1 drop of gas is gonna fill it up? No, you have to fill your tank. You got to literally fill it up. So that's the way it is with IV vitamin therapy infusions. So if you purchase, we always give you discount. But with the ozone promotion, I am working really hard, although my prices are increased, to give it to you at a price that I know many people can afford. Even if you cannot, I want you to really ask the universe, ask whoever you believe, source, power, God, Jesus, to help you find the funds, because your health is the only thing that you need to work on. It's your priority. Many of you guys want to make money. You want to be there for your family. You want to perform. You want to open businesses. You want to buy a house. You want to buy a car. You want to travel next year. But if you don't have your health, it ain't going to happen. And the reason why I'm seeing less patients now, because I want to stay healthy. I don't want my stress. I don't want the stress to, I mean, it's been very stressful if I'm being honest with you, but I am managing my stress, managing my cortisol, looking at my hormones, getting tons of rest, and just, working with my capacity. Okay. So your health, like my money, all my money goes to my health. Like literally. I'm wearing the same clothes. Like my clothes are looking good. I spend a lot on my health, on food, on looking at what I need to monitor, assess and evaluate, on IVs. I do IV vitamin therapy just like you all. I told the patient the other day who came to me on Wednesday, she has a virus. And I told her, and she's like, oh, do I wear a mask? I said, no, it's not because I am, invisible and viruses cannot get me. It's because I work on my health. And I know I can face any viruses right now. Nothing will happen to me. It's not because I'm better than you or no, but the things that I do behind the scenes that many of you guys are not watching, seeing right now is keeping me healthy. I walk the talk. I am health. I am literally doing the things I'm asking you to do. Literally doing the things that I'm asking you to do. If I'm asking you to do IVs, after hours, behind the scenes, Marilyn and I, we're doing IVs. We don't promote it. We don't like film it. Maybe we should. We're doing IVs. Like right now, I just did an IV for Marilyn on Wednesday because somebody in her family has a strep throat. And I'm like, we cannot afford to be sick, right? That it's not in my vocabulary. So let's go. Let's pump up some vitamin C, some zinc and NAC into her. And I spoke to her yesterday. She's feeling amazing. So we do exactly the same thing. Trust me, we do. I am health. I am health. I talk the walk. I walk the talk. Is that what they said? Anyway, so reach out to me. Again, be proactive, act preventatively, okay? And start saving your money for ozone. It's coming. And the weight loss program is coming. I know many of you guys are asking. I'm working on a weight loss program. I'm also working on a hormone program that is separate from my signature program. I have so many things coming in the works for you. Just please be patient. Know that I'm always thinking about you. I'm working behind the scenes to bring things that will highly benefit you. But first, we got to look at the capacity. We got to get some help here. And then things are coming. But in the meantime, the detox program is available for those of you that are like, okay, I need to detox. Please reach out. That program is amazing. Every single human being that goes to that program not only lose weight, they feel lighter, they feel great. Every single one of them tells me. Okay, if you're watching this video and I want you to comment, say, yes, that's me. I did the detox program. I felt great because I know you felt great because we check on you every week, right? Like literally we're sending you a message every week. And when you're part of the detox program, it's a month long, everything's included. All the supplements are included. You get 5, you get 2 meal plans, and you get 1 month access to me and Marilyn to practice better. So that is like, I don't know where you get access. Like you can send me any messages every day, Monday to Friday, 9 to 3, not every day, Monday to Friday, 9 to 3, and you get an answer within 24 hours or less. And you're not paying for that. You don't have to schedule an appointment, right? To come in and talk to me and send me a message. There's no copay involved. Your insurance doesn't have to pay for that. It's included. And you get 5 products and you get 2 meal plans and you get a whole bunch of other videos. So it's like a no-brainer when I tell people, and that the price is going to go up next year, sorry. Because again, prices went up and I'm adding to it. It's $750 for all that. Yeah. And then you feel great. You have more energy. You lose weight. You feel lighter. Everything's included. It is amazing. All right. So please reach out to me. Let me know how we can support you through IVs to detox. And I can't wait to communicate with you. Tell everybody that you know, your friends, your sisters, your mothers, please help us help more people. I really appreciate you. I love you. And I am looking forward to seeing you soon.